Did you know your knee joints have bone, joint, muscles, ligament, meniscus, nerve, tendon, and all working together? Every second you walk, jump, sit, or run, lift any object. So, let's understand the complete knee joint in the easiest way. Hello, everyone. I'm Sudha, and here we will learn complete knee joint anatomy in a simple and easy way. So, bones of knee joint, as you can see, femur, tibia, fibula, patella. So, let's understand one by one. First is femur. Femur thigh bone, the large upper bone forms in upper part of the knee joint. The rounded lower ends are called medial and lateral condyle, and its function is transfer body weight to the leg, helps knee movement. And second, patella. Patella is a kneecap bone, small triangular bone in the center located in front of the knee joint, and its function is protect the knee joint, improves leverage of quadriceps muscles, helps smooth knee extension. And the third bone is tibia. Tibia is also called shin bone, the large lower leg bone, main weight bearing bone below the knee, and upper flat surface called tibial plateau. This area articulate with the femur, and its function is support body weight, helps standing and walking. And fourth bone is fibula. Fibula, thin bone of the outer side, not directly involved in the weight bearing, but muscle attachment provide lateral stability. This image shows the four major ligament of the knee joint. Ligament are strong bands of connective tissue that connect bone to bone and help stabilize the knee. The image is an anterior front view of the knee joint. ACL, anterior cruciate ligament, inside the center of the knee and runs from front of tibia to back part of femur. The ACL crosses the PCL forming an X shape, and its main function is prevents the tibia from sliding forward, controls rotational stability, and important during running, jumping, cutting movement. And second, PCL location, it locates deep inside the knee behind the ACL, runs from back to tibia to front part of femur, and its function is prevents tibia from moving backward, stabilizes knee during bending. And third, MCL. MCL is locate inner side of knee, connects femur to tibia, and its function is prevents excessive inward movement called valgus stress, and stabilize medial side of knee. And four ligament is lateral collateral ligament, LCL, and its locate is outer side of knee, connects to femur to fibula, and its function is prevents excessive outward movement like varus stress, and stabilizes lateral side of knee. This image shows the menisci of the knee joint from a superior top view of the tibial plateau after removing the femur. The two while crescent shaped structure are medial meniscus and lateral meniscus. They are made of fibrocartilage and act as shock absorbers inside the knee. Menisci are crescent shaped cartilage pads, and it's located between femur and tibia, important for knee stability and cushioning. Each knee has one medial and one lateral meniscus. The upper flat surface of the tibia, where the menisci sit, is called tibial plateau. Medial meniscus is located inner side of the knee and more C-shaped, larger and broader, and less mobile, formally attached to joint capsule. uh, as medial collateral ligament. Because it is less mobile and tightly attached, it gets injured more commonly. And lateral meniscus located outer side of the knee, shape in more circular or zero shaped. It is more mobile, less attached to capsule. More mobility means lower injury risk compared to medial meniscus. And now moving to tendons. This image shows the anterior front view of the knee joints, tendons and ligaments. Tendons connect muscles to bone, helping movement and stability of the knee. And overall functions of these tendons together, they help knee movement, stability, force and transmission, shock control, walking, running, efficiency. And I can tell you easy memory trip, like all tendons. Above patella is quadriceps tendon, below patella is patellar tendon, inside knee MCL medial collateral ligament plus pes and serenus, and outside knee lateral collateral ligament plus IT band. This is best way to remember this. Now we know the muscles around the knee joint and their functions, anterior and front view. These muscles helps in walking, running, climbing stairs, squatting and stabilizing the knee, of course. First muscle is rectus femoris, part of the quadriceps muscles group and located in the center front of the thigh, and it's help hip flexion, extend the knee. And second muscle is vastus medialis. This situated in inner part of the quadriceps, important for patellar stability and help in knee extension, keeping knee cap aligned. And third muscle is vastus lateralis, and this muscle is outside of the quadriceps and largest quadriceps muscle, and it helps in extend the knee. And four muscles is vastus intermedius, and this muscle is deep muscle beneath rectus femoris, and it helps in knee extension. And next muscle is quadriceps group. In quadriceps groups, mainly four muscles included: rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. And these four muscles helps in strengthening the knee, important for standing and walking. And next muscle is sartorius, long strap like muscles, and runs diagonally across the thigh, and it help in hip flexion, hip abduction, lateral rotation of hip and knee flexion. Here two types of nerve work for knee joint: motor nerve and sensory nerve. In motor nerve, we know femoral nerve, tibial nerve, common peroneal nerve. And in sensory nerve, saphenous nerve, sural nerve and intrapatellar branch. And these two kind of motor and sensory nerve function around knee joint and supply motor and sensory part. As we can say, these nerve work together to control movement, sensation and stability of the knee joint and of course lower limb part. Thank you for watching, and I hope you better understand the knee joint anatomy. Thank you.